Good evening. Welcome to the Georgia Doty Report on Comprehensive Health. My name is Beverly Walker, and I'm the host for tonight. We have with us Ms. Cheryl Garrett, who is the managing partner of CNS Next Level and the corporate liaison for the Georgia Doty Community Comprehensive Program. And we also have Mr. Everett Foney, who is the president and CEO for New Benefits and Financial Services. Ms. Garrett is going to talk about her community responsibilities for corporations to work with organizations that fight health disparities, as well as her role with the Georgia Doty program. And Mr. Foney is going to talk about benefits for seniors. I want to welcome both of you.
Thank you.
I want to start off with Ms. Garrett. Ms. Garrett, can you explain what your job duties are with the Georgia Doty program?
Okay, yeah, I'd love to. Georgia Doty Comprehensive Health is a 501c3 corporation, and what we do is we provide education through several means to help seniors, veterans, those affected by HIV, hepatitis C, diabetes. We do so through forums, through symposiums. We are involved with a lot of programs and events that educate people on different diseases. We give them resources, we give them options so that they can help themselves. We're looking at communities, specifically communities of color, to help them in health disparities.
Okay, can you also give us some information on what you do as a managing partner for CNS Next Level?
Sure. My role in CNS Next Level, I'm a managing partner with my partner, Sean Cheney, and we work with, we're business strategists, and we help take companies to their next level. Some companies are in the red and they want to get into the black, and then there are other companies that just may want to expand, increase their sales team, increase their effectiveness. So that's what our organization does.
So now, can you tell me, are these non-for-profit organizations or are they for-profit?
Well, they can be either. Most of our clients are for-profit, but we do work with not-for-profit, and so that's kind of how that led me down the path to looking at Georgia Doty, because it was so interesting to me to see the organization and to hear our president Don Doty's plan. Who he and his wife Joyce are such hard workers; they work tirelessly at this, and I know that Mr. Doty, they were both looking at retiring from the organization, but were called back because of the great number of health disparities that are in the communities, and even looking at expanding from Chicago into the Atlanta, the LA, and the Las Vegas markets.
Yes, I've had the opportunity to work with Mr. Doty myself.
Mm-hmm.
He did a reentry program with some of the adult transitional facilities, and we went in to do some education on HIV and substance abuse and hepatitis C.
Mm-hmm.
It was a great program. We worked through those programs for quite a number of years. It was really good to work with him as well.
Yes.
I also understand that Mr. Doty is having a gala coming up.
Yes.
Can you tell us about that?
I absolutely can. We are so excited. We are having, this is the 5th annual year of this awards gala. It's the 2018 Georgia Doty Comprehensive Health Awards Gala, and it's going to be held on Saturday, July 28th from 6 p.m. to 10 p.m. At 6 p.m. we're going to have a VIP reception, and then from 7 to 10 will be the actual program. It will be held at the South Shore Cultural Center, and we are honoring various pioneers are going to be recognized for their contribution with health disparities in our communities. And if I can, I'd like to share who those honorees are. We have Father George Clements, who we know is a great community advocate, Beulah Brent, who is CEO of Sisters Working It Out, which is an organization for cancer. We have Camille Garrett, who is an insurance broker. James Dentley, who is a very well-known motivational speaker, has his own 501c3 organization. We have Eli Williamson, who is the president of Leave No Veteran Behind. Ms. Jackie Sharp, who's CEO of Lakeside Committee, and then we have Reverend Tommy Johnson, who is the founder of Outside the Walls Ministry. And all these people have had great impact in the communities, and we're honored to be honoring them.
Thank you. I've had the opportunity of working with Reverend Tommy Johnson as well, and he does a great ministry with ex-offenders and substance users as well.
Yes.
Okay, let's kind of shift gears a little bit and talk to Mr. Foney. And am I saying that correctly? Foney?
Foney. Okay.
Foney. Okay. Who is president and CEO. He's going to talk to us about benefits for seniors. He's going to be discussing the new changes that are upcoming for Medicare, in Medicare. But one of the things I want to have you discuss with us is the difference between the Affordable Care Act and Obamacare. Now, I know, having worked in the field for many years, that Obamacare and the Affordable Care Act is the same thing. But can you explain that for, because there are a lot of people I know that don't understand the difference.
Yes, well, first of all, when it comes to the Obamacare program, it's actually the Affordable Health Care Act that was created back in 2010. And under the Affordable Health Care Act, it provided different services. It was designed for people who was uninsured. And those were individuals who was not working, those people who did not receive Medicare, those people who was not on Medicaid, or who was not on a group plan. So it was there to fill in the gap so people who were going around without health insurance. Now, they called it Obamacare because President Obama signed it into law. The difference is this. Obamacare is just the name. So when it comes to the Affordable Health Care Act, it's mainly for people who do not have insurance. Medicare, if you're on Medicare, you're not affected by the Obamacare program or the Affordable Health Care Act. He signed some provision into that program that was to strengthen Medicare, but you're not required to get onto Obamacare if you have Medicare or Medicaid or you have a group plan.
Okay. You talk about changes that are coming up for seniors. What are some of the changes that are coming up that are going to be effective for some of the seniors?
Well, first of all, what I try to do when I talk to people about the changes, I kind of go back into the past and bring them up to the present, because Medicare has been changing year after year. You know, it was signed into law back in 1965, of course. It was signed into law by President Johnson. Now, what Medicare did, it provided a national health care program for all Americans, because before that, a lot of our seniors and our poor families were going without adequate health care. So when they signed into law, that was to bring a national program into place. But Medicare, as it stood back then in 1965, was never designed to be as a standalone. And most people are using the same Medicare A and B card 53 years later as their primary source of health insurance. But it was never meant to be as a standalone. So therefore, over the years, there was a lot of provisions that's been added to strengthen Medicare. Each year or certain years, there were certain things that were signed into law to have Medicare strengthened. So you go back to 2006, they added the Part D program. You go back to 1997, they added the Medicare Part C, and so on and so forth. So now, when you fast forward up to now, when President Obama signed the Affordable Health Care Act, it added some components that would strengthen Medicare so Medicare would not go broke, and it strengthened it to 2034. The provisions start taking place mainly in 2013. But one of the things that it brought for everyone, every health plan, it provided wellness and preventive care. So now people can go under Medicare, under their group plan, under whatever plan they have. They got zero premium screenings for tests, for mammograms, pap smears, colonoscopies, things like that, because we felt that early detection is important when it comes to health care in its form. So over the years, there's been a lot of different programs been added. You have chronic condition programs. Those are programs designed for people with special conditions like diabetes or heart failure or chronic asthma. They have different programs like that in place. You have the donut hole being eliminated through the Affordable Health Care Act. So a lot of seniors will take a lot of medication, and then near the fall they will run out of coverage for insurance. So the donut hole is going to close the gap, and by 2020, everyone will have coverage on the Affordable Health Care program with Medicare. You have a lot of different plans that's out there. We call the Part C plan. Most seniors don't understand how it works. When you get original Medicare, you have basically two options. You can purchase a Medigap plan, that's something that you pay for, or you can enroll into a Medicare Part C plan. If you work 10 years or more, 40 quarters, you are entitled to enroll into a zero premium health plan. Now, there's different types of plans out there. There are HMO plans, there are PPO plans, there are private fee-for-service plans, and there are POS plans. But most people don't know how they fall. So what we do as our agency, we're insurance advisors. We sit down and analyze what the senior's needs are. So we make sure that you find the right plan for you so you have the lowest possible out-of-pocket expense.
So you would be able to sit down, talk to a senior, and help them select whether they need a Medicare supplement plan or Medicare Advantage plan.
That is correct. And it all based upon, okay, how much can you afford? See, when you retire, most people are on fixed income.
Right.
They have Social Security. A lot of people don't have pensions or they don't go back to work. So they're on a fixed income. And most of the time, when you're on fixed income, you have to make a choice between paying for your prescriptions, and some people have to make a choice between eating. So we have to look at your overall picture. What are your needs? Okay, what can you afford to pay for? If you can't afford to pay for a supplement, and I tell some seniors, why do you pay for a supplement when you don't have to pay it? Okay, now some people like to go to the doctors of their choice. But within that case, they're kind of like self-managing their care because they keep Medicare primary. And then what they do, they have supplement and they purchase a supplement and they purchase a Part D program. Under the Medicare Advantage plan, you can enroll into a program contracted with Medicare through these private insurance companies and get all the extra services.
Okay, I see we have a caller on the line. Caller, you have a question or a comment?
Yes, I heard that the Georgia Doty was producing something to deal with medicinal medication, medicinal marijuana or cannabis related to health issues. Is that true?
I'm sorry, can you repeat that?
He was asking about the medicinal marijuana. Yes, Georgia Doty is very involved with different programs with the medicinal marijuana, and those are soon to be announced. There are working with different organizations, and that's one of the things why we here today, it's very important that people become educated. As Mr. Foney is saying, that education is very important, and Georgia Doty is in the forefront of making sure that people are aware of the benefits of medicinal marijuana. As a matter of fact, 2 programs ago, there was a couple of programs ago, there was a program on the medicinal marijuana.
The Georgia Doty program is also going to be having a forum on the medicinal marijuana, where they're going to be inviting people out from the community come in that are interested in seeing how they can actually qualify for the use. So that's going to be held in the future. Thank you, caller. Okay, Mr. Foney, you've talked about some of the changes of Medicare. Are there any additional changes that will be coming along the pipe with Medicare?
There are rumors to have additional services coming down the pipe that's non-traditional. That is expected to come out in 2019. That's still in the planning mode. We don't know which carrier or what they will have, but some of the things they talked about was having programs that include grocery programs for seniors, within these plans. They also talked about having air conditioning for people who have chronic condition. They also talked about having a transportation program through the Lyft or the Uber program for seniors who need to have access to transportation outside of the primary health care doctor to go to specialists. So it's a lot of things that's being thought of in the pipeline, but we have to wait until the 2019 season is announced to find out what carriers are being offered.
Okay, so if those programs become effective, they will be available at the beginning of 2019, or?
If they become, because what happens is every April each year, each company have to submit their benefits for 2000 for the next
following
year. Okay, to CMS, and then CMS announce in the fall what plans is available. So we can't really go into details until they find out what they decide to do.
Okay, can you tell me how the baby boomer generation affects the healthcare system?
The baby boomers affect everything. And this is what, and they look at it like this. From 1946 to 1964, it was 80 million babies was born, and we're now all baby boomers. And what is happening now, the baby boomers are retiring in masses.
Right.
And they stated that it's going to be close to 10,000 people turning 65 for the next 12 to 14 years. So therefore, what do you think is going to happen when all the babies take their money, the baby boomers take their money out of the workforce, and then you don't have enough people in our generation who's working to offset the baby boomers? Plus, we're living longer. Just you're staying healthy with all the different technologies and the programs. So it's going to be a tremendous effect on the economy. They talked about some things that how it's going to affect Social Security also. That's something that we'll have to share with you in the future about an article that talked about how it's going to affect Social Security by 2022 for people that they are paying into the Social Security system, and they will not have enough money from the amount of people that's working versus the baby boomers retiring. So we really affect what goes on in the economy. This is one of the reasons why they are trying to have more people on the health plans outside original Medicare, because right now, the way it's set up, the government pays everything when you're on original Medicare. Original Medicare, the way it was set up back in 1965, is the same 53 years later. And they basically has no stop maximum out-of-pocket in place. Okay. They just basically pay the claims. And you have a lot of doctors and facilities, they bill Medicare for whatever is needed.
Right.
And so the system is collapsing, especially with the amount of baby boomers that's retiring. So the whole idea behind this structure that President Obama put in place with the Affordable Health Care Act was to fix and strengthen Medicare. That's what the whole purpose was.
Wow, that's kind of interesting.
Very.
That's kind of interesting. I remember way back, they charge, when you're paying for healthcare now, you're paying a lot more money than you was 15, 20 years ago. It used to, I remember when my mother retired, she didn't have to pay as much money as she would have to pay now if she was retiring. So things are costing a lot more. I know people are paying, I'm hearing people tell me that they're paying $100, $125, $150 a month just for their medications that they have to get.
Yes.
Mm-hmm. So I can see where a person has to decide on if they're going to eat steak or salmon versus paying for their medication. Mm-hmm. It makes a big difference. And I know myself, I've had to look at one insurance versus another type of insurance just to kind of decide on whether it's going to benefit me in the long run, not just today, but am I going to be able to get the maximum benefit out of the insurance that I'm being offered. So it makes a real difference. And then you have people who don't have, older people who don't have anyone to really sit down and explain this information to them, mm-hmm. and even younger people who are on disability that are receiving Medicare insurance who don't have anybody to explain it, and it's hard for them to comprehend, and they just accept what they have. And then they end up in a situation where they have to have surgery, and then they have to go to a facility for rehab or something, and they're not liking the facility, or they're not getting the stay as long as they need it, and then they got to go back home, and so they're getting the short end of the stick. So it makes a lot of difference. So if those changes can become effective, then that'll be an addition, which will be really, really good.
I want to ask you, Everett, a question. As Beverly was talking, I was thinking about, although I like to claim I'm 38, I'm really 55. So what can I expect in the future at 65, 10 years from now? What am I looking at?
Let me tell you, some frustration and go ahead.
What you may be looking at, with the way it's going on, you may be looking at the possibility of having the age of Medicare to retire for Medicare raise. Okay, from 66 to 67 to 70. They're looking at all type of platforms because of like I stated, the baby boomers are retiring. You don't have enough resources that's paid into the system to offset the amount of people that's retiring. So that could affect a lot of the people in the mid-50s, early 50s, when they get ready to retire. Will it affect me? Once again, you notice that in 2015, they started raising the price for Part B. Okay, it used to be, before 2015, Part B was $104.
Right.
Now it's $134.
$134.
They're making people pay more. They're making pay more for Part B deductibles. So everything's affected based upon what happens with the baby boomers.
Yeah, you're right. That's for sure. So we're going to be trying to wrap this up. You've heard all of the information that Mr. Foney has given you. I'm not going to even try to wrap it up. Cheryl, I do want to say that was an excellent question. I have a twin sister, and we're talking now about the retirement, and she's talking about, well, maybe I need to work another year. And I'm saying, get out while you can. And she's saying, well, maybe I need to work 2 more years. So it's a real question. And those of you in TV land that are listening to us, you really need to take some time and decide on what it is that you really need to do. Look at your finances and your expenses, and really try to sit down with somebody and come make that decision. I want to go back to our overhead where Cheryl can talk about the Gala Award that the Georgia Doty program is going to be doing.
We'd love for you to join us at our gala. If you have an organization, please, you can contact us at www.georgiadotyinc, that's INC.org. That's www.georgiadotyinc.org. You can find information there, or please feel free to call us at 312-282-1375. We'll be happy to give you information about the awards gala. It's going to be an exciting time honoring people and celebrating the years of service of Georgia Doty for over 20 years.
And for more information for Mr. Foney,
You can, for more information, you can visit our website at retiredandhealthy.com. It's an educational website for the senior, retiredandhealthy.com.
thank you.